I think, as in general, place of people really plays a critical role for so many people who are the most vulnerable, people who've got obviously not only mental health disorders, especially people with severe mental illness, but also many of those people are also very physically vulnerable and are the people who would be at high risk if there was a COVID-19 infection for them. So in that way, I think what we need to do is continue to reach out to people, to educate them, to help them be safe, to link them with necessary care, starting with the medical health care as necessary, but also helping them with any, obviously it's a stressful time, with any stress or symptoms that might bring about because of the community-wide, the global stress right now, really, because of the coronavirus. Well, I mean, to be honest with you, I think we're kind of figuring that out, and part of what we're trying to do is figure out what we can do and do safely. And there's this kind of contradiction in some ways because we're asked to do social distancing and to be able to have minimal social contact, and at the same time, we're talking about people who need services and need support. So we're trying to prioritize who are the people who can. Who need face-to-face contact, whether that's medical or whether that's psychiatric or other important needs. And then other folks right now, and there's been some very recent changes in the Medicaid regulations that allow for billable telephone contacts, which before it's always been face-to-face. So in that way, I think our role is partly to be able to provide support for people, education, many people, even some of the basic information that many of us take for granted. So I think right now a lot of it is providing education and support and then assistance as necessary, again, prioritizing medical needs, but also helping people around the stress, the anxiety, and the exacerbation of symptoms. And we're talking about people who have a lot of symptoms to begin with, so providing support that's necessary and intervention to help with the mental health as well as the physical. You know, we have this contradiction again because we are being asked to socially distance in order to prevent or slow down the spread of the virus, and at the same time we know that social support is good not only for one's emotional and mental health, but it's also good for one's physical health and immunity. So I think in that way that partly we need to be able to do things more creatively. Again, kind of the use of the telephone, although not everybody that we serve even has the access to the phone, but many people do, to be able to use the phone and to be able to, talk with people about ways that they can continue to build connections and build social support. Might be a good time for them to be able to reach out and to call family members, to call friends, for people who have access to computers and internet, to be able to do FaceTime or Skype, or do those kind of things. But I think partly we want to get that message out. Even though it's healthy right now to distance physically, you don't want to distance emotionally. Who are the people that are still important to you? Can you talk with them? Some of that are the service providers here, but helping people to kind of, again, think about the other folks in their life and to maybe to proactively plan those kind of contacts, because if you're staying at home, hunker down more, you're less likely to run into people, but with a little bit of planning, you can, again, reach out and make those connections and get social support. And again, I think that's a question that applies to everyone, every one of us right now, because we're dealing in a situation where there is a lot of concern and anxiety and unknowns, which sparks anxiety. So I think in part that starts with awareness of the situation that we're living in, and also awareness internally of what are we feeling. And it might be, again, that kind of stress or anxiety. And then to go beyond awareness, and well, I guess the other thing I would say about awareness of safe practices of hand washing, social distancing, what symptoms are. So awareness about those kind of things, but awareness of our own feelings. And then I think another A word, if you would, in addition to awareness, is acceptance, and to be able to accept that Right now might be a time when we're feeling more anxious, worried, and often we're in a society where we try and deny those feelings. Instead, just to be able to accept it, but to accept it and then to be able to, as much as possible, to let go of that, not to get stuck on that, not to obsess about that. And some ways that we can do that is in part looking at what I would call the 3 C's. One of those would be control. What are the things you can do that can control the situation? Again, social distancing, hand washing, those sorts of things. But to recognize there's not, again, we can't control everything. We can't control everything usually in life, and this is a situation that brings that home even more. And then also about connection. How do we stay connected? And we were just talking about that connection remains really important, and to be able to proactively reach out to people, make phone calls, do that through the internet. If you have family members, to make sure that you have those, good contacts and relationships. And then also, I think, to practice compassion. I mean, one of the things that this teaches us is that the world is truly a small place, and we're all interconnected. And even though we're all interconnected by our vulnerability to a virus, but we're all human, we're all going through this. How can we have that kind of increased compassion for each other? And sometimes there's a way to even be able to help other people with that. If we stay focused on ourselves, sometimes it's difficult then we're more likely to be anxious or get worried. But if we think about, hey, I know I've got an elderly relative or somebody else is isolated, maybe I can reach out and give them a call. Maybe while I'm at the grocery store, I can pick up something and drop it off on their porch for them if they need some basic food or other kind of supplies. And then finally, I think that the other part is to practice some things that are useful anyway, like gratitude. In a situation like this, we're often concerned and worried about all the threats that are out there, and that's true, and we need to be aware, but not, again, to get stuck with that. So it's a good time to ask ourselves, even in this difficult times, what is it that we're grateful for? And maybe each day to take a few moments and to ask yourself, what are 3 things that you're grateful today for? And if we focus on that, that helps our well-being, it helps our happiness, it also increases our resilience to stress. And so many of the people that we serve here, as well as in other public mental health facilities, are people who are not only have the severe mental illness, but have co-occurring health conditions that are serious, of things of coronary and respiratory diseases, COPD, for example, diabetes, high blood pressure, other kind of illnesses are common, so they have those compromised immune systems to begin with. So I think in that way we want to recognize really as a community and as a society that we're working with very vulnerable people. And we know from research that even when there isn't a virus, that the life expectancy of somebody with severe mental illness is anywhere from 12 to 25 years shorter than for a person in the general community in that way. So now's the time that I think we need to also, again, kind of prioritize the health and the well-being of those individuals and to make sure that they're getting the attention, support, and medical assistance they need. Thinking about people who are maybe potentially vulnerable and more likely to be at risk because of their mental health or their physical health or their demographic factors, and recognizing that they might be more isolated. Is that a time you can reach out to them, maybe with a phone call, asking them if they need you to pick something up for them? And again, to have kind of maybe that increased sense of compassion that this is scary for all of us, and if it's scary for me, then it's probably scary for you, and it's scary for the next person. So can we open our hearts and have even more compassion and caring for each other that will probably, if we have that in our hearts, it'll probably be palpable, in our actions to other people. And finally, I think that, this is also a time for those who have the resources to be able to help contribute from things like food banks to certainly, we have a need that we can put those resources to bear through client assistance funds for people who are, low income, as so many of the people we serve are, and really often don't have that buffer of resources the way most people do. So for our individuals who are working, and if often they're working in those jobs who are in the service industry of servers or cooks or restaurant or hotel workers, which are getting hit hard, for them it's a huge economic loss. So again, any kind of contributions or things that we can be able to help other people through client assistance funds as necessary to help them get through a really difficult time.